Chromatographic techniques are used for the analysis of the pharmaceuticals, and HPLC is one of them. HPLC is a very widely used analytical testing technique for the pharmaceuticals. There are certain common problems in the HPLC. These are related to the analyte, the chromatographic conditions, or the equipment. In this video, we will learn some of the common problems and how to solve them. So let's start with the introduction. Examples of some common problems like ghost peak, fronting peaks, baseline noise, or no peaks are the common problems. So why these problems are required to be solved, and why HPLC problems are critical to understand and solve. So as these problems matter in the analysis, these impacts the accuracy, precision, and reliability, affect the system suitability test and SST results. These type of problems may lead to batch rejection or OS/OT investigations. If these problems are coming, then we need to waste our time to solve them. We will waste the solvents and resources, so that we should always try to prevent these type of problems. The problems are required to be solved for the method robustness and regulatory compliance, and to get the accurate results, reliable results. So first problem is ghost peak. So as the name indicates, it is unexpected or it is unexplained. We do not know the exact reason. So these peaks are unexplained peaks that do not belong to the analyte or any impurity. And these ghost peak appearance, or if the ghost peaks are observed, these indicate the contamination or system memory effect. Ghost peak causes are contamination from the previous injections. There may be some contamination. It is coming and it is observed as ghost peak. Carryover in injector, needle, or sample loop. Leaching of impurities from HPLC components, dirty glasswares or sample preparation issues, low-grade solvents or mobile phase contamination may lead to appearance of the ghost peaks. Then inadequate system flushing between the runs, that will lead to carryover effect and some contamination, which will lead to appearance of the ghost peak. So what are the solutions? Using HPLC grade solvents and freshly prepared mobile phase will solve the problem of ghost peak many of the times. Then flushing of the injector, needle and sample loop, cleaning and replacing tubing and column if needed, performing blank injections to detect the contamination. Many of the time blank is run to have the understanding about the contamination and to prevent the appearance of the ghost peak. Implement regular system maintenance and column cleaning. So out of all these, you might have understood that what are ghost peaks and how they can come, and the solutions. So use the clean glasswares, use the freshly prepared mobile phase, and try to find out the reasons for contamination. Then fronting. There are two types of problems like fronting and tailing. So fronting means distorted chromatographic peak where the leading edge is wider than the tailing edge. So in fronting, it is opposite of the tailing. Fronting peak causes are like a column overloading. If your column is overloaded with the sample or because of the concentration of the sample, it may lead to peak fronting. Column heads, column head voids or damaged stationary phases or stationary phase. Then incorrect mobile phase pH, altering analyte interaction. Because pH of the mobile phase will have impact onto the separation, it may lead to fronting. But many of the times, because of the high concentration of the sample, fronting may happen. and incomplete column equilibration or contamination can lead to fronting. How to solve it? So reduce the injection volume or analyte concentration, replace or repack damaged column, adjust the mobile phase pH to recommended range, and properly equilibrate and flush column before the analysis. So these type of problems can be solved. Then baseline noise. So baseline noise means it is an instability in the baseline or fluctuations in the baseline. Normal baseline is plain or straight, and you can have some peaks or fluctuations in the baseline, which is known as baseline noise. So fluctuations or instability in the baseline that affect sensitivity and quantification accuracy. The common causes are like detector instability. You might be using the old lamp, UV lamp. Thermal fluctuations may be there, air bubbles or poorly degassed mobile phase, dirty or contaminated detector flow cells, then mobile phase incompatibility or mixing issues, pumping pulsation due to worn seals. Some of the problems, reasons for the baseline noise problem. Then how to solve it? So degassing the mobile phase can give you relief from the baseline noise. You can do some activities like sonication, helium sparging, vacuum filtration, replace aging UV lamp, clean or replace flow cell, keep column temperature stable, and perform pump maintenance. So by this you can solve the problem of baseline noise. If you are not getting any peak, that means there is no peak. So flat line or no peak, and as we know, we need the peak to have the separation and detection. No peak or flat line is the problem. No response observed even after sample injection indicates injection detector or flow issues. That means you are injecting the sample but it is not getting detected. You are not getting the peak. So common causes are no sample injected, very low concentration of the sample, blocked or faulty auto sampler, syringe or needle, detector off or incorrect wavelength, wrong method parameters loaded, no flow or leaks or mobile phase blockage. These may be the reasons. So how to solve the problem of flat line or not getting the peak or no peak? Reconfirm sample preparation and concentration. Check auto sampler operation and blockages if any, and ensure detector is on and wavelength is correctly set, because if your detector is not on, then it will not detect anything and you will get the flat line. Verify method parameters like flow, wavelength, injection. Then inspect entire flow path for leaks or air gaps. Then you can get the correct peak. So here are some examples of the peak problems I have shown through the diagram, through the image. Good peak is there, peak tailing is there, fronting is there, then peak splitting is also there, shoulder peak is there, or baseline peak or absent peak, then negative peak and broad peak. These are some of the problems commonly observed in the HPLC analysis. So now we will quickly go through the problems which we have understood. Ghost peak means contamination issues, then fronting peaks means column overload or damage. Baseline noise is because of the detector mobile phase or pump issues. No peak means injection detector or flow failure, and routine maintenance proper method setup can give you the stable chromatograms. So this is regarding the problems associated with HPLC. These are common problems and how to solve these problems. HPLC remains a great technique, a widely used technique. So we should always have understanding about the problems and how to solve them for getting the accurate, reliable, robust and repeatable consistent results. Thank you for watching the video.